Hello and welcome to the MEDSURG Nursing Journal podcast series. This series provides extended content relating to articles published in the journal, such as author interviews and roundtable discussions. MEDSURG Nursing is the official journal of the Academy of Medical Surgical Nurses. The November-December 2018 issue of MEDSURG Nursing featured the article, The Impact of Resiliency on Nurse Burnout, an Integrative Literature Review, by authors Shannon Brown, Dr. Ramona Wicello, and Sheila Price. In this episode, MEDSURG Nursing Editorial Board member Susan Bohnenkamp talks with Dr. Wanda Larson, the RN Program Director of Nursing Research at Banner University Medical Center and the Program Coordinator of the Master's Entry to Professional Nursing and Assistant Clinical Professor of the University of Arizona College of Nursing in Tucson, Arizona, about resiliency in the professional practice of nursing. Many nurses experience high emotional exhaustion, which may lead to burnout. Workplace stressors contribute to exhaustion. Strategies to overcome these stressors and increase resilience may help nurses create positive environments, thrive in their work, and prevent burnout. We are proud to present Susan Bohnenkamp's and Dr. Larson's discussion on resiliency in the nursing profession.
Hello, I am Susie Bohnenkamp, a clinical nurse specialist at Banner University Medical Center in Tucson, Arizona, and I'm also on the editorial board for the Academy of Medical Surgical Nursing. I want to welcome everyone listening to this podcast, Using Resiliency in the Professional Practice of Nursing. I looked up the definition of resiliency, and it is the capacity to recover quickly from difficulties. Sounds important to me as a person and as a nurse. In Robin Hertel's AMSN President's Message, and this was in the November-December issue of MEDSURG Nursing Journal, she discussed the National Academy of Medicine's data that showed 43% of nurses experienced high emotional exhaustion. So not quite half of our nurses are experiencing high emotional exhaustion. Many of us are working in high-stress areas. We've seen shortages of staffing and other resources which may result in burnout and a higher turnover rate. The shocking thing to me is that this stress can lead to long-term effects on our bodies, like heart disease, metabolic syndromes, and depression. Shannon Brown and colleagues published an article in that same issue of MEDSURG Nursing, The Impact of Resiliency on Nurse Burnout, and they did an integrative literature review. These authors discussed the nursing shortage, which may reach up to 400,000 by 2025. So we need to keep the nurses that we already have in our profession. Their article reviewed characteristics of nurses with high resiliency, which included self-efficacy, good at problem solving and critical thinking, they're flexible, they're optimistic, they have good communication skills, a positive self-perception, spiritual, physical well-being. They use mindfulness techniques. They use emotional distancing as an effective coping strategy. And some have children. They have years of experience and degree of BSN or higher. Some of the strategies they suggested to increase resiliency and prevent burnout from their literature review were specific training, so training on conflict resolution, and then also training on mindfulness-based stress reduction. As nurses, we need to care for ourselves, improving nutrition, increasing exercise, using mindfulness activities, and spiritual well-being. We need to learn strategies to cope, develop support system, and work on team building. Today, I thought we'd take a deeper dive into how nurses might use aspects of resiliency to support themselves and their professional practice. It is my pleasure to welcome Dr. Wanda Larson. She is a professor of nursing at the University of Arizona and an RN with over 40 years of clinical care experience in emergency and medical surgical setting. Dr. Larson has spent many years focusing on how resiliency-related skills support nurses and other interprofessional healthcare providers in their professional practice, particularly those who tend to work in extremely high-stress settings.
Thank you, Susie, and also to the Association of Medical Surgical Nurses for inviting me to this podcast. I appreciate that Robin Hertel and Shannon Brown's articles shed serious light on the topics of stress, burnout, and resiliency for all of us nurses. Perhaps I can add to this important dialogue through examining the physical and mental stress responses and also considering how we as nurses can and do grow and thrive in our profession by taking some intentional, caring actions towards ourselves and others while we are in the midst of many work-related stressors. Even while there is a large and growing body of data that is concerning us all, specifically that nurses' work-related stress unreasonably contributes to nurses' high relative rates of burnout, PTSD, turnover, leaving the profession, disrupted relationships, and even suicide. Yet, a growing body of evidence also identifies inherent opportunities in our day-to-day nursing professional activities to uncouple these concerns. There is evidence of resiliency and skills that can be individualized to help us thrive and grow amidst the many opportunities and memorable experiences we can have within our profession. How we experience stress and how we optimize opportunities to de-stress could be two sides of the same coin. So let's begin by taking a closer journey into the background associated with stress, appraisal, coping, and resiliency, and offer some thoughts to consider. How might we intentionally apply one or more evidence-informed skills to support resiliency? And what skills can we incorporate more intentionally and even take home to help us thrive within our profession and personal lives?
While I offered one definition of resiliency, Dr. Larson, how would you define resiliency?
That's a great question because I actually have some alternate definitions of resiliency that I think are a really good fit within our profession. I like to think of resiliency as an ability. It's an ability to bounce back or to recoil or gain original shape under stress, which is a pretty broad definition. But the one I particularly like for nursing is that it's sustained competency under stress. As we look at that, I find that there's, taking us back to the stress responses in the workplace and beyond, a lack of meeting basic needs such as nutrition, i.e. eating real food, not much, mostly plants, sleep hygiene, activity, exercise, and making sure that we're safe and sheltered, lack of sense of control over situations, feelings of being overwhelmed, feeling threatened, losses, or over-challenged, a lack of social support, social isolation, loneliness, or not feeling valued or rewarded that are the large drivers of stress responses in our workplaces and beyond. And when I look at that list as it's come through the literature, I start to see Maslow's hierarchy of needs really from the basis on up for basic needs, safety, love and belonging, esteem, and finally into self-actualization. And it's when we can really stay in those higher parts of the Maslow pyramid that we find we're more likely to be able to start really effectively using our de-stress responses by having met those basic needs. So the de-stress responses really become almost the opposite of stress. Those are those individualized tools to effect really a relaxation response. As we look at our data that neuroimaging has provided for us, we find that the relaxation response activates the reward, motivation, and retention areas where new learning and memories are formed in the brain. So through relaxation, or through having appreciative and caring thoughts, or by really finding those moments of joy and happiness, we actually activate different parts of our brain and directly counter a stress response. When we invoke the calm chemistry and really work across our mind, body, spirit, we find that things like perspective testing, what is that a reality or is that just our perspective on something? How do we adapt and gain meaningfulness in our lives or in our job or in this moment with a patient? How do we use slow diaphragmatic breathing to invoke the relaxation response, especially when you place some imagery with it, such as what you might hear in your head for some favorite rendition of music, or taking that moment to just be in the moment for 10 or 15 seconds while you're washing your hands at the sink as preparing to enter a patient's room. How might you say those quick silent prayers? Or how might you use guided imagery for taking yourself into that comfortable place? Or as you're getting ready to open the door of a room, taking that 3 seconds to pause and envision yourself as very present with the patient that you're about to encounter, and leave the last few moments of frustration or hurriedness behind as you get ready to enter a patient's room with a deep sigh and a long exhalation. How do you use smiling and laughter? We know the data shows us that just the simple act of smiling, even if you don't feel like smiling, or laughing when there really is nothing to laugh about, but just creating a laughter, shifts our body chemistry and takes us out of our midbrain, where the amygdala might be on super high, like a speedometer at 100, and just a few moments of laughter or smiling can drop that stress response and take us out of our midbrain and back to our prefrontal cortex, and really living in that left prefrontal cortex where our happiness center loves to live. How do we reach out? How do we, as we're passing down the hallway, issue and receive kind greetings? Taking a moment to look at someone and greet them also, we know, has a strong effect on reducing the stress response. Connecting with that social support, finding standardized ways that we use and apply our check-ins with each other, the healing and encouraging words that we use, and how we learn to manage conflict competently are all very key ways that we move towards a relaxation response and move away from a stress response. Another powerful way that we can move towards a relaxation response is how we use reflection and reflective activities in our work, such as written journals, or finding those moments when you have someone that you feel safe with and you can talk it out. Also, when you have those high-stress events, a rapid response, or a difficult family interaction, or a patient that you've cared for a period of time that actually didn't survive the day, how you use your after-action reviews with your team and coming together and going over the situation, identifying what worked, what could have worked better, and walking through the entire situation verbally with the team in an after-action review are also very powerful de-stressors. And why it's just so important. These are the kinds of things that fit into what we commonly termed in the research and educational programs we've started developing at the University of Arizona for our nursing program is integrative well-being. How we take what we learn in a full human spectrum to care for ourselves, to care for the others, to care within the unit of the organization and the community, all are just different levels of the same skill set. We find that in nursing studies, the worrisome thing about suicide, post-traumatic stress disorder, depression, anxiety, substance misuse, and unstable relationships. But we also find in looking at our new grads that we're launching into the profession, that we're looking at their readiness and how they are going to be retained and thriving in the profession by entering the profession comfortable with this skill set.
So you've mentioned several strategies that could be incorporated right within a daily routine. Are there other evidence-informed strategies that improve effectiveness?
There's a few that come to mind, actually. One is a little controversial, but Amy Cuddy has developed and published on what she terms power poses. And power poses are a way to kind of gain back your strength when you had a really difficult time or when you feel real uncertain. One way of doing a power pose is by putting your hands firmly on your hips, throwing your head and your chest back, and standing like you're Wonder Woman for 3 to 5 minutes. That's thought to create a shift in brain chemistry as well as giving you a sense of strength and direction. Another strategy of using the power pose is more the pose you would have when you threw your hands up in the air, crossing the finish line in a race and kind of breaking the ribbon with your chest. Those are 2 power poses advocated by Amy Cuddy in her work. Another one is out of Martin Seligman and Brian Sexton, who popularized the 3 good things. At the end of a day, or the end of a shift, or right before you go to bed, is a time when reflecting on, regardless of what happened through the day, you reflect on 3 really good things that occurred that day. They can be small, but by reflecting and shifting back to a positive mindset with those reflections, you gain a lot. Another one is Barbara Fredrickson's work that helps us remember that it takes 4 or 5 positive things to overcome one negative. So paying attention and getting really mindful about when you're being negative, when you're contributing to negativity, and that knowing that one negative needs to be overcome by 5 positive when they come out. A 4th one would be your caring meditation. There's strong work by both Jean Watson in her Mindful Caring, or Las Caritas, as well as the Heart Math Coherence, for how being able to maybe just take your hands, cross them over right where your heart would be in your chest, lean back, and move into the next 3 to 5 minutes of slow, deep inhalation and exhalation while considering the people that you love most, someone that you care for or has cared for you in your life, and really bringing in the imagery of that caring moment, which will also substantially shift our chemistry, open up our prefrontal cortex so that we can problem solve effectively and decrease the stress response while encouraging that relaxation response where we remember better, we problem solve better, and we release a lot of stress.
What are some considerations for caring for others on the team in addition to caring for ourselves?
Well, this brings to light how we move from an individual to more of a group or a systems level of caring. And I think one thing that we start with is you need to identify and meet your peers or your clients kind of where they're at. And in doing so, being able to really look at what are they doing in terms of coping. Can you identify what coping strategy they're using? Is it resilient? Is it adaptive? Try not to pathologize on it, but just identify where they're at so that you can then meet them where they're at. There's a lot of range of normal functioning, as we all know, and on any given day, we might appear more normal than not, or not. And when we look at how someone might be appraising an event as a challenge versus a loss, that can have a lot to do with it. So look at your teammates. Is what they're encountering something they're appraising as a challenge, a threat, or a loss? One thing that I remember happening in the firefighter world was when they'd have a novice firefighter on the scene and they weren't really functioning well, they would really start working to switch their mindset to see the challenge and not the fear or the loss in what they were experiencing. And I recall working several years ago with a pediatric intensivist in the emergency department that whenever we'd have that really ill or dying child come in, he would quickly gather the team around the child and start pointing out challenging aspects of the situation we were dealing with. And it helped bring people back to a challenge mindset rather than a threat or a loss. In a challenge mindset, a team tends to be living and thinking from their prefrontal cortex. In a threat or a loss mindset, they've shifted back into fight, flight, and freeze, and they become less effective. Another thing we can do with our team is recognize when they're in operation mode and they're moving forward, and you need to think of how to keep them marching so that you're not asking them to pause and reflect and get into a feeling mode when they're trying to stay in a very much thinking mode. So being respectful of where they're at and the timing of any interventions, being cognizant of things like conflict competence, what you're saying to yourself in your self-talk, what you're saying to your peers in your peer talk in those high-intensity moments can be really important. Because we know that when people are under extreme stress, things go straight into their unconscious, and they act from their unconscious rather than from their conscious brain. So the best you can do is to help recognize when someone is ready to have a conversation or just work around with the situation to meet them where they're at. All of us could get better at surveilling for adverse stress responses, the signs and symptoms, the severity, and each other's triggers, and being, again, able to effectively appraise and cope and know when people are using different styles and strategies of coping to help peak performance can be very important.
So how do you recognize the different ways people are coping?
That's an excellent question, and there are several great models for that, but one I particularly appreciate is Lazarus and Folkman, in looking at stress appraisal and coping, identified 8 coping ways, of which one, emotional distancing, was mentioned by Shannon Brown as being a very dominant way of coping that many resilient nurses use. The challenge with emotional distancing is that it's, as all of the different 8 ways of coping that Lazarus and Folkman identified, is one way of coping, and it may not always be the best way for every circumstance. Or if you only have one way of coping that's your dominant way of coping, you find that when it doesn't work for you, you have nothing to pull in to help manage the situation by more effective or adaptive coping. So let's take a look at all 8 ways of coping, recognizing that they are all neutral. It's when you use them and how you use them that makes them effective for you. So adaptive coping is important, and being also able to recognize what style of coping someone's using so that it can be, if not working for them, adapted to an alternate thing that may work better in the moment. One way of coping is called confrontive coping. This is where sometimes it's considered aggressive to alter the situation, but you need a way of kind of stopping the line and making some kind of suggestion, and preferably to minimize the amount of hostility or risk-taking. So this comes with what we'll talk about later in teaming with conflict competency. How do you stop the line, and how do you intervene when you need to, in a way that's not perceived as too aggressive? Emotional distancing, again, a very common term and strategy for EMS providers, law enforcement, nurses, because we recognize that although we care for patients, it's not our emergency. We manage to distance ourselves from it emotionally. The problem with emotional distancing, it may be a great thing to use at work, but how does that work when you go home and use it at your family level? Or how does that work when the patient you're actually caring for is somebody you know, or someone who reminds you so closely of someone you know, or someone you've gotten very close to in the time that you've cared for them? Then emotional distancing really doesn't work. How about self-controlling? So these are the efforts to regulate one's feelings and actions and just kind of be in control. Well, that works unless you're going to be home and trying to have a conversation of meaning with perhaps your children. So how are you going to use self-controlling? Sometimes you can see people overreacting with self-control, where they just become unable to communicate as a result of being so self-controlling, and so meaningful conversations that need to happen don't. Seeking social support is probably the number one most effective skill that is underused by healthcare providers. We know that we are not good at reaching out. We are not good at being dependent, but we need to seek information. We need to seek support. We need to find those moments where seeking that social support, that safe person to go to, can be obtained. I know that in my early career, it was not good for me to go home and try and debrief with my husband on a really difficult day, because he would just try and fix everything. But I knew if I went and sat with my mother-in-law and talked about my day, that she would just listen and nod and be present for me and give me that kind of social support. So in deciding your social support, you really need to decide who you're going to call when, how you're going to garnish that support around you, and how we're going to help with peer support across the team as needed. Accepting responsibility is another big coping strategy defined within the ways of coping by Lazarus and Folkman. And that's where we learn to acknowledge our own role in a problem. When we own a problem, we have parts of it we can fix. We don't have to own the whole thing, but we need to at least own the part that's ours to own in order to put things right. Escape and avoidance is another way of coping, where you have wishful thinking or behavioral efforts to escape or avoid the problem. You'll find that it goes along at times with the emotional distancing, but it does suggest more detachment, where they just kind of exit the area. Sometimes it's a strategic way to kind of just step back and say, this is something I need to handle, but I'll handle it a different day. Planful problem solving is probably another very effective tool for use by healthcare workers and nurses. This is where you get very deliberate about a problem-focused effort to alter the situation, to make it right, to be able to figure out, what did I learn from this? How can I go forward? What do we need to do not to have this happen again? So it gets coupled with a very analytical approach to problem solving. And of course, in the moment, positive reappraisal is one of the most effective coping strategies we can use. It's that effort to create that positive meaning by focusing on personal growth. Often it has a spiritual or religious dimension, but it doesn't happen to. Sometimes it's just more like what your grandma said to you. Think of the bright side, girl. There's something positive in every moment. There's a lesson to be learned, and let's find it. So as we look at those 5 driving skills, we can look at the kinds of specific skills that we can use on a daily basis in our nursing profession that really support our resiliency, well-being, retention, and safer patient outcomes. And again, all of this is informed by the psychoneuroimmunology. We can see a lot of this come to life in brain imaging. And we know that as nurses, we have many day-to-day opportunities that help us really thrive, because they are the thriving skills that we have inherent in caring and compassion for others, as well as ourselves. From the positive psychology movement and research, we've looked at the benefits of caring and compassion and how it brings such great benefits back to the person who's doing the caring as well as the person receiving it. We know that positive mindsets and happiness can be constructed just by a simple smile, 5 or 10 minutes of laughter, or a reappraisal of the events to think of the meaningfulness of those events. We know that in just thinking, we change our brain chemistry, and the imaging that we do with when people are smiling and laughing, we know opens up their prefrontal cortex, and their happiness center that sits right there at the left side of our prefrontal cortex comes to life. We know that the 3 good things that Seligman and Sexton and even Richardson really emphasize of happiness brings us momentary reflections that help shift our chemistry. We understand that the individual relaxation strategies of mindfulness, which can be done just in a 2 to 4 minute meditation, a deep breath, a long exhaling breath as you enter a patient's room to gain presence with them, a pause and enter at the door of that room where you can recenter yourself, recognizing the value of presence at a patient's bedside when they know you're really attending to them, and at times taking them or you through a guided imagery of the joyful moments that take you back to that happiness center. We understand also that our team support strategies are invaluable. Teamstepps is a standardized teaming program known to many hospitals. It's practiced actively in over 250 hospital systems in the United States. It was developed out of the Agency for Healthcare Research and Quality in cooperation with the American Hospital Association and the Department of Defense's Medical Division. As a standardized teaming model, they have really worked on things like conflict competence, so that you are able to use collaborative communications, like, can you clarify this for me? I was just wondering about this, without being confrontive. Or when you find that you are in competitive communications, they encourage the use in a very benign way of something like a 2-challenge rule. Like, I was just wondering about this because I'm concerned, I'm uncomfortable, or this could be a safety issue. And that's where they use their cuss words. So either challenging them twice, restating it twice of your real concerns, or moving into the I'm concerned, I'm uncomfortable, this could be a safety issue, are really helpful ways of managing conflict. Knowing that when you're kind of out of your league or you're too frustrated in the moment, that you are able to have somebody at your back willing to allow you to step out and say, I need you to go in and talk to this patient because I need about 5 minutes for myself right now. Recognizing how we work within our team, being attentive to each other's emotional needs, and recognizing when we're contributing to emotional contagions in the environment which may not be helping us and might be taking us to a negative path. So that kind of trusting, safe, nourishing well-being in our workplace takes place and embeds because we make it happen. We do those things which help us shift the culture and help us make sure that we're on our peak performance for clinical judgment and decision making because we've learned to work within our team. So we've taken quite a journey through the toolkit of intentional skills, of resiliency, much of which is informed by positive psychology, and also help us optimize as nurses the benefits from living in a caring and compassionate profession. We've also looked at how we might be more consistent with optimizing our environment of care and the work that we do within our units. How evidence has informed resiliency education and how we use that education for ourselves and to teach others. And we've really looked and defined that the resiliency presents itself in 5 drivers that can be bundles of skills that all the skills fit within. And those categories are trust, belief, persistence, strength, and adaptability. I appreciate this invitation to share our work and perspectives, and also would like to acknowledge the many researchers in healthcare, humanistic, and positive psychology who continue to lay a foundation for work on how we can better thrive under stressful circumstances and experience post-traumatic growth through our most difficult life events. I especially would like to give credit and appreciation to an amazing team of interprofessional researchers and educators that I have worked with over many years. These dedicated professionals share endless hours to frame and develop the specific integrative wellness nursing curriculum underpinning the bundled skills that we actively teach, to include Cynthia Dowdell, Phil Callahan, Michael Marks, Mike Grill, Heidi Kosenki, Lindsay Bouchard, Patty Wilker, Kenny Oya, Christine Pasquet, Judith Simon Prager, and many, many more.
Thank you so much, Wanda, for all the information related to resiliency, how we can use many of the resiliency-related skills as a toolkit to draw upon for ourselves, and how we may be able to better support others in our day-to-day practice. Thank you again for listening to our podcast.
The MEDSURG Nursing Journal podcast series is owned and produced by Genetti Publications Incorporated. All rights reserved. No portion of this podcast may be used without written permission. Dr. Wanda Larson is the RN Program Director of Nursing Research at Banner University Medical Center and is also the Program Coordinator of the Master's Entry to Professional Nursing and Assistant Clinical Professor of the University of Arizona College of Nursing in Tucson, Arizona. Ms. Susan Bohnenkamp is a clinical nurse specialist at Banner University Medical Center in Tucson, Arizona, and is a member of the MEDSURG Nursing Journal Editorial Board. For archived episodes of this podcast and to learn more about MEDSURG Nursing, the official journal of the Academy of Medical Surgical Nurses, visit the journal's website at medsurgnursing.net. You can also subscribe to the MEDSURG Nursing Journal podcast series on iTunes, Spotify, Google Play Music, Stitcher, TuneIn Radio, our hosting site Spreaker, and other various podcast delivery services.